session, so I'm going to go ahead and start recording so that we can come back later and watch it, so that anyone who has any problems or any questions will know how to get in touch with our new program coordinators here. We're also going to provide a way for you to get Tejano passport points so that you will be able to get a medallion by earning these points. And so I'll be putting that information in the chat box. So at this time, please make sure your mics are muted, and we'd like to welcome Mr. Ernesto Castro. Thank you so much.
Hello, everybody. My name is Ernesto Castro. I've been in the medical field about 25 years. Started back in the United States Coast Guard as a rescue swimmer paramedic, stationed out in Galveston Island. I was on a little 24-foot rescue boat. I'm sorry, 40-foot rescue boat, 42-foot rescue boat. Those were really unique because they never capsized. But, you know, being in the medical field and seeing a need here in El Paso for echo, I'm really excited that EPCC has now started the program starting in June. June 1st, we're actually starting that 10-student program, and I'm really excited to lead it. So let's regress back just a little bit. So what is echocardiography? So an echo is also known as an echocardiogram or a cardiac echo. It's simply an ultrasound. So as you know, in medical imaging, you could either image bones with X-ray, and that has a little bit of radiation. But with ultrasound, all we're using is sound waves. And with the sound waves, we're able to have the machine interpret those waves as those signals come back, and we make images. Not us personally, the machine does with these large calculations. They make these beautiful images of the heart. And so what is the importance of all this? We play such a huge role in people's health. Ultrasound is such a unique modality, and it's kind of like the redheaded stepchild for X-ray for some odd reason, but we save just as many lives as anybody else. So anybody with hypertension, high blood pressure, your heart is going to change a little bit. There's a cause and effect and a cause for all that stuff. And so a sonographer and a cardiac sonographer would come in and analyze that patient's heart to confirm A, how the patient's function is, how it's functioning, how it's moving. We're also going to check the anatomy. We check to see the enlargement. Is it too big? Is it too small? Is it too thick? We also check valvular function. And we have valves in the heart that tend to have more disease depending on the person. And the other part that we like to check with Doppler is valvular or pressure. And that's very unique. We use pulse wave and continuous wave Doppler to get these measurements of the heart. And there's basically a rhythm to them. Okay, so if somebody has a diastolic dysfunction, if somebody is going through some sort of coronary artery disease, we get to see the effect of it in real time in front of us on the machine, and that basically allows the physician to be able to diagnose the patient, and if there's some sort of problem or pathology that exists in the heart, we can take action. And so one of the things that frustrates me here in the medical field is we're not really big into preventative medicine, but ultrasounds are so safe and available. You know, we should definitely use ultrasound more often for, you know, for health, for preventative medicine to have that direction. In a nutshell, echocardiography is a part of ultrasound. We specialize specifically in the heart. We check for anatomy. We check for valvular function. We check for systolic and diastolic dysfunction. We check for aortic and aorta diseases, like you know, anything that might be like an aortic dissection or any type of unique pathology that can exist. So we're really important. And now, so the school, excitingly enough, we start the program at the Rio Grande campus. I believe the new building is going to be, there's going to be a part of it for us. We're really excited. We have new machines. We have the sim lab. The sim lab is actually a simulation that will allow students to be able to assess patients without actually having a physical person there. It's a complete mock. and it's in real time. You can see heart function, you can pause it, you can manipulate it. So it's as though you're doing an ultrasound of the heart. But we have a machine to help us educate the student. So we're really, really excited for the program. There's been a lot of people working very, very hard. So I'd like to thank everybody. Becky, definitely Miss Brown, my Dean Soraya, Nora, everybody's just been so supportive, especially when I got hired a year ago. Unfortunately, COVID just hit. So it was very chaotic for me. Not a lot of connections except for online, phone calls. Developing the curriculum is my job right now. So, there's not a lot of time to kind of chit chat, but I do look forward in meeting more of the staff at EPCC. My email is available, and we have some paperwork that I wanted to kind of share with the staff and the people here at the workshop. And one of them is the actual health career, technical education, the applied science of associates that we have. It's online. The official catalog is online, and I believe we can share the link for the catalog. And the program information has my contact information, a program map. Within this, they also touch base about the general requirements, including, what we will be requesting next year with the TSI scores. We also have, the ranking information for echo on this, so that it can be really specific to what if you want to know exactly what you need to study and get out of the way so you can get into the program. The program starts this summer. It'll be initially taught with an introduction to echocardiography techniques, and we jump right into the curriculum, into the practicum in August. So in August of 2021, students from EPCC will be out working at hospitals and cardiology offices, helping echo sonographer, cardiac sonographers work with patients. They're gonna learn the assets of the hospital, cardiology, transesophageal echo, stress echo. It's just so much that we're gonna be jumping into. It's really exciting. So the screen here shows the catalog. For the adult echocardiography, you can find that on page 102. It gives you a breakdown of what we'll be going through. Nora from the general ultrasound DSMO will be assisting with some of these classes as well, including some of the vascular portions of echocardiography. We do specialize in the heart, although the heart is related to the veins and the arteries of the body. So it's always good to have that understanding of the system as a whole and be able to take that with you in the field. So we have added some vascular classes to the echo course just to make that student a lot more valued and marketable. And that's the idea here at EPCC, right? We want to make sure that once these students get out of there, they don't have to come back anymore, at least not for the same criteria anymore. They're just going to continue to learn on their own. Some of the resources that we have in echocardiography is the ASC, the American Society of Echocardiography. It's a very, very good location to get information, journals. You could even become a member of it, and they end up sending you journals online and covers at your house. It's a really good way of kind of studying and continuing your continuing education as you move forward in the career. The other part is we educate you up so that you can pass the registry. The registry that I'm under is ARDMS, and with that registry, you take a test. Initially, it'll be a physics test. It's called SPI. Once you pass the physics portion, then you're allowed or allotted the next course, which would be echocardiography. Under echocardiography is a pretty massive test. Once you pass that test and master the echo portion of it, they register. You're registered, and you can continue. You can start working. Hospitals, clinics, they will pick you up before graduation. Most of the time, they give you about 6 months to pass. And right when you graduate, you're allowed to take that SPI test. And then after 2 or 3 months, you're allowed to take the general echocardiography portion of it. The best part, though, is once you're done doing echo and you want to pursue something a little bit more complex, like fetal, pediatric echo, vascular, general, all these other great modalities that exist, because you're registered with the ARDMS group, you can just study it, follow somebody who's registered, have them sign you off, and you can take that test. Once you pass that test, then you'll be able to do that specialty as well. It's a really, really great advantage to be able to have this type of ability with this group, with the ARDMS, to be able to pass your physics, to specialize in your adult echo, to specialize in vascular, and just to continue to grow. I've been in the field for a while. I graduated from the echo program back in 2008. I went to the Arizona Heart Institute, taught by Terry Reynolds. He's the granddaddy of echo, and the program was pretty intense. I can tell you that the people who I graduated from, they're doing very well. And it's not about the financial part. I'm saying they love helping people. And that's, I think, one of the goals I want to make sure that I touch base with you all here today is, the medical field is a unique monster, but the one thing you can't ever stop kind of forgetting is that it's a service industry. And that service industry is to help, and not only to help others, but think about you and your own family. Do you want somebody to be arrogant and ignorant to attend your family and not really be compassionate enough when they're doing an ultrasound, an x-ray, a lab, even greeting you at the door, right? And so making sure that we also have those soft skills, I'm really going to hope to push that on my students so that they understand that we're coming into a field and working with people who are some very, very sick. Some of them are on their deathbed and they're ready to transition soon. And the last thing they want to hear is these smart aleck remarks or anything about what might be negative to them. So learn your patients, learn your environment with your patients, and that's something that I hope to teach my students here in the upcoming course. So I think I covered it all, and I wanted to kind of have some questions answer, or open the door to some questions in case somebody had some questions. And Martha Brown is here, and she can also help and tackle some of these questions that might exist. But for the most part, I hope that I answered the understanding of what echocardiography is in ultrasound. When we start, which is going to be June 1st, we're really excited. The modalities, the different modalities after learning echo that you have, so it's like an open door. You can do anything you want from that point, and nobody can necessarily stop you. You just got to find somebody to train you, but you don't really have to get back into school unless, again, we do offer the certificate program for ultrasound. So if you're an echo sonographer and you pass the ARDMS, SPI, and adult echo, you can come back to EPCC and do the certificate program for ultrasound and do that, and you can sit for your registry and take the test. So it's pretty exciting. I believe there's somebody with the hand up, so let me get that question going. Give me a few seconds here to get that window. Here it is. Hi, Ernesto. Materials loaded. I don't see, if you have your hand up, please let me know.
Hi, Ernesto. This is Becky. How are you doing? I had a question. Is your program pretty competitive, and do you have a ranking system to get in?
Yes, the ranking is on the sheet, and it's going to be even more competitive. It's equally competitive as the diagnostic medical sonography program. So a lot of those students, have 4.0. Their TSI scores are really high, so of course it's going to be very competitive. The actual class as well is challenging. It's not easy. If it was easy, everybody would do it, and that's why it feels good. It feels good to help somebody and know that you're doing the right thing for them. Yeah, very competitive. But again, El Paso needs this. I believe there's probably under 10 people in El Paso that are registered to do echo. So probably the two, like Las Palmas has one, two, excuse me, Del Sol has one, all the campuses have one. So, you know, this is a needed field in El Paso. We need to help our people of El Paso, and we need to educate, everybody here so that we can get more students and get that ball rolling, but very, very, very competitive. Anybody else have any questions, please?
I have a question, Ernesto. So then you said that this summer, is that when it's going to be starting, or is that when you're going to accept your first class?
Yeah, well, it's going to be starting actually. So we have started getting applicants for the program. So it's been very exciting. Class starts June 1st. It's a 10-week program. And as you see on this paper, on the next, I think it's page 3, we start in the summer. So the first semester we'll be doing the DSAE 1203. That's going to bring us into Introduction to Echocardiography. And in the second semester, which is August of 2021, or also known as the fall semester of 2021, we'll be having 3 classes. They get to jump into EKG, principles of adult echocardiography, and then they're actually in the clinic. Trying to structure it so they're in the clinic 3 days a week for 6 hours, or the hospital 6 hours. You're going to be, it's hands-on. You're going to see the blood, the guts, the heart attacks, the everything. And so these 10 weeks are going to be really vital. I've got to, get those students to start understanding what they're going to be seeing, get that thick skin on. The professionalism has to exist. So we've got a lot of work ahead of us. A lot of work ahead of us.
Thank you. Thank you so much. And I know Dr. Brock, Tomaselli Brock, has a question as well.
Yes, please.
Hi, Ernesto. How many students are you planning to accept this year?
I believe we're doing 10 this year, and hopefully next year 12.
Okay. And my guess is that you are going to be moving into the new building that we're building at Rio Grande. How do you see your facility there looking? Can you describe what your facility is going to look like to the audience?
I've only seen diagrams, unfortunately, so I'm not sure exactly the 3D, but I can tell you with the amazing technology that EPCC has spent for the student to get that sim lab, to get the machines. We got the highest top machines. I mean, even hospitals don't have the machines we have right now. So the student's going to be having to kind of like downgrade when they get to the hospital a little bit. For the most part, machines can be the same, but just so that the everybody knows here, EPCC, it seems like they really took care of the program, the startup program. So everything is obviously brand new, and we'll have the simulation lab, we'll have the patient, the beds, we'll have an echo machine. Everything's going to be simulated just as a clinic, so that we can attend patients there, and it's as professional as the day one. So we need to make sure that we keep that thought process for the student, that once they're in echo, for me, it's a long process that I've had all my life. So I hope that the students that come in feel the same way, that they want to retire in this field. So
sounds really exciting.
Yes, and I welcome all of you as well later. Once the program starts, come and get an echo. It's always good. Again, I believe in preventative medicine. Why not check the heart? Why not see how thick it is? Why not see if you have any clots? Just so you know, you can have a tooth infection. That tooth infection can go into your heart. I've found very, very interesting vegetation in the heart many, many, many times. So as unique as we think, or as we think certain things can happen, you'd be really surprised on what we see in trauma level 1 hospitals. And some of the stuff that I've done was in Los Angeles. So I worked at the transplant center. So I've dealt with transplant patients. And it's amazing. I can tell you a story, but we have a question, so let's hear the question.
So the question in the chat is, why is physics needed as a core course requirement?
Oh, because physics is everywhere around you. You're going to learn sound physics, but you need to have the basis and understanding of physics. I wish that people could understand the importance of it, because it's everywhere. It goes with chemistry hand in hand. Without chemistry, you couldn't have physics. Without physics, you couldn't have chemistry. It's the almost, love is the frequency of life. Well, within that frequency is the physics and the chemistry of life. So in order to have a full understanding of how sound waves work, how we're also having to use the ideology of interpreting the heart in a 3D shape, because we're seeing things in TVs and everything's in 2D. But as a sonographer and with learning physics, of course, you're going to see how the sound waves are penetrating the heart at different angles. And the equations are huge, massive equations when you're dealing with velocities coming out of the heart. We're dealing with like 6-7 centimeters per second squared of velocity coming out of an aorta that's stenotic. So you need to understand that. What's the purpose of that? Why are we even discussing that? And so physics, if you don't have a foundation in physics, you're not going to truly understand what we are doing and why we're even helping. So having that foundation, and it's difficult, but we can assess it. If you try hard enough and we push hard enough, we can achieve this. So the light is at the end of the tunnel, but we need those people to try. And so if we can get them to try, they're going to succeed. I can guarantee it. Any other questions?
I have a question also regarding when the students go into their careers. So when they're working in hospitals, how does that work? Is it like shift work? Are you looking at 12-hour shifts? What kind of work environment are they looking at?
Oh, negative. There's hours in the curriculum that they have to meet, and it's about 6 hours, 3 days a week, up until the last semester. Then they're going to be working 8 hours, 3 days a week. They're still going to be in class 2 days a week, learning, the curriculum and the theory and everything that's just as important. But for sure, those 3 days are going to be at 6 hours. So they'll be in either a hospital, a clinic. Again, I have Dr. Lawal, who's our medical supervisor at APCC for this specific program, allowing a student. UMC is taking 2 students. Trans Mountain Providence is taking 1. Memorial is taking 1. I believe the cardiology clinics that's connected to T-HOP is also, they've got 5 or 6 locations, or 6 coming up soon. So there could be a student at each one of these locations. And the benefit of both is that in the clinical sense, you'll have adult echocardiography and something called stress echo. So to give you a little breakdown really quick, because we have a little bit of time, 7 minutes. A resting echo tells us how your heart's doing at rest. You're not moving, you're not jumping around, nothing's happening. So we're going to give you the functionality at rest. If I have you walking and your heart changes its functionality, there might be coronary artery issues, but that's only existent if it's 80% or more. So if it's 80% or less, there's not going to be any functional changes. Now, if we get them on a treadmill and we do a stress echo, which means we're going to do images initially at a resting, check that functionality, get the patient onto a treadmill and get them walking really fast, and take them off of the treadmill really quick and check their heart again. We're checking that functionality. If there's a change in that functionality, that person more than likely has a blockage in the coronary artery. So it's going to tell us huge numbers. That's what they're going to learn in the clinic. In the hospital, you're dealing with heart attacks, open heart surgeries, valvular problems. I mean, you name it, we see it. And so it's pretty intense. I hope I answered the question.
You did. You sure did. And then once they graduate, what kind of work schedules can they expect, depending on where they work, I guess?
Yeah, they can do anything. You can work in manufacturing companies, like Acuson calls me all the time wanting to hire me for sales. They need people to go do, to work the machines before they process them out. You can work for the government. You can start your own business. You can work for cardiology offices. It's pretty much open, especially here. The need is available. So if the sonographer stays in El Paso, we need you here. If you decide to go abroad, you'll be fine. You'll find a job in San Antonio, New York, Los Angeles, anywhere you want, you'll find a job. So it's not a bad field to be in.
So the certification is nationwide?
Absolutely. And as a matter of fact, you
Great.
could even go to England and they will allow you to take the registry, but it's pretty much accepted over there. If you have an ARDMS registry, you can work in London.
Nice. Okay, great. Thank you. Thank you so much.
Thank you. So I have 5 minutes. I just want to give you a quick little story about Cedars-Sinai. I worked at the transplant center. Really unique story. So people get transplants all the time. After a year of having a heart transplant, the physician allows you to write a letter to the family that lost their family member. Very tough to write. Think about what you would write. You got a heart from somebody, you're alive now, and you have to thank their family. I don't know, tough one, right? So I've talked to these patients, you ask them, what do you write? And you just, they tell you the most beautiful stories, right? Like complete gratitude, not one hint of anger, no jealousy, no, it's really good to talk to people like that. I met a lady and she wrote the letter, they wrote back, the family wrote back and asked one thing. So the lady was in her 40s that got the transplant, but she got a transplant of a lady who was in her 20s. In 25, she had two babies, a 3-year-old and like a 7-year-old or like 5-year-old or something, 3 and 5. And so when she passed, she wrote the letter and they finally they were able to meet somehow. The lady just said, if you ever want to meet me, I'd be more than happy. The husband wrote to her and said, absolutely, my kids, it's been a while now, they miss their mom. They would like to talk, if that's okay, to you, if that's all right. And so the initial meeting was at a McDonald's and they agreed to meet just there the one day. Well, when I met her, they've been meeting every month for 2 years, and the lady goes to the McDonald's every month without a complaint. And these two beautiful little girls talk to the heart and say, Mom, I miss you, and Mom, all this other stuff happens. So it's really, really amazing information. Things that we do for people on an everyday basis in Echo. And I hope that these stories can kind of resonate with you so that you can tell people how amazing ultrasound is and how amazing science is right now, because we're pushing things and going to new endeavors, and it's good to be where we're at right now. So it's pretty amazing.
That's awesome. Thank you so much. Thank you for sharing that. Does anyone have any questions?
Ernesto,
Yeah.
I have one question. What is the starting pay for the Echo?
It fluctuates. Here in El Paso. You can probably get a 25 because you have 0 experience. If you have more experience, obviously your range goes up to $30, $35 per hour. And again, it depends on what you're doing. I have friends that work for GE and they make about 160 a year. And they live up in, I believe they have a GE up in like Washington, like Vancouver, Washington somewhere. And so that's not bad.
Oh, it's not. It's awesome. Thank you so
Yeah,
much.
so it just depends. And then again, if you're learning more things and you're putting more things under your belt, you put vascular, a general ultrasound. I mean, if you become this marketable person, which is solely your freedom, this is like the complete freedom portion of it. Like you can do anything if you do it, and you can. I know sonographers that have their modalities and everything, and they're helping everywhere, and it feels great. Like we can sleep at nighttime. We really can.
Great, thank you. Thank you. Anybody else have any questions? So if we have students that are interested, what would be the best source of contact for them to get in touch with you or with the counselors?
Yeah, I think Martha Brown would be your first point of contact. She's amazing. She'll make sure that you'll have your other credits. You get the prereqs done. She can guide you. So I think connecting with Martha Brown initially would be good. I'm available 24/7 though, so feel free to touch base with me. I am still writing curriculum. I'm at the end of the pathology, which is the bulk of Echo. But I'm here. I'm available, of course. So it's not a problem to answer questions, but my point of contact would be Martha Brown. And if I'm incorrect, please, Martha, let me know. But that's what I would start with.
No, that is correct, Ernesto. And my information for anybody who needs it is in the echocardiography information guide that you can find on the web, and which is the one that is being posted right now that everybody can view. Um, email me, call me. I'm available for whatever questions you have. Thank you.
Thank you. All right, thanks to you both. I'm really excited to see this program start. So we'll check back with you soon and have you present again so we can talk more about the program once you're in the building. Maybe we can show some screenshots of what it looks like inside the building as well. So thank you very much.
Absolutely.
And now
Thank you for
I
having us.
appreciate that. Thank you. And now we're going to be switching over to Ms. Dr. Tomaselli Brock, where we're going to be talking about the physical therapy assistant program that we have at EPCC. So Dr. Brock, whenever you're ready.
Yes, hi. Can you see my screen?
Yes, we sure can.
Okay. So I'm Dr. Debbie Tomaselli Brock, and I've been with the college since 1990 when I opened up the program. And I got into physical therapy because I saw a picture that's very similar to the one that you see on the screen. It was very inspirational to me. It was a child walking on down the parallel bars, and there was a therapist behind that child helping that child learn to work. Now you're looking at newer technology. This is a suspended ambulation device over a treadmill. So the program has graduated 300 roughly students in the past 30 years. This coming year, we will be next year, 2022, we will be celebrating our 30th year, and that's very exciting. We currently have 3 full-time faculty, and the program has been accredited from the beginning. I don't know if you know this, but there's 27 programs in Texas for physical therapist assistant. And there are 2 programs that are in El Paso, but we are the only community college for about 200 miles. The program itself is a 5-semester program, and it starts in the fall after a specialized admissions procedure that culminates in June. The 5 semesters is a full-time program with roughly 40 hours in class and then another 20 hours of homework at night. So it is a very intensive program. We take 12 students a year. We would love to expand because we have more students that qualify than can physically get into the program because of our space limitations. So hopefully someday we'll be able to do that. With a 40-hour intensive 5-semester-long program, included in that is 720 hours of clinical experience that occurs in a variety of clinical settings, including hospitals and nursing homes, pediatric clinics, schools, um, private practice physical therapy clinics. So there is a wide variety of exposure that our students get to the various practice settings that physical therapist assistants can work in. In addition, our curriculum has built into it a collaborative bridge to the UTMB physical therapy program. Not all students can qualify, but our capstone course is designed to increase the chances of our students being able to meet the required benchmarks to be able to participate in that bridge. The bridge has only been available for a couple of years, and we currently have 2 students who are in the application process, one of which I recently heard had been accepted into the bridge. The nice thing about this bridge is that it is a guaranteed spot for one of our graduates to go into the UTMB PT program if they qualify for the requirements for the bridge. Well, you might be wondering what kind of jobs physical therapy has. Well, there are a physical therapist and a physical therapist assistant. And so so the physical therapist is a person that works with patients just like PTAs do. The biggest difference between the PT and the PTA is that the physical therapist does the evaluations and writes the um, writes the treatment plan. And the physical therapist assistant carries out that treatment plan. There is a large difference between the two educational programs as well. Physical therapists are doctorally trained um, therapists, and the physical therapist assistant receives an associate degree. Um, so the jobs, though, that PTs and PTAs have are very common. We all work, as I started to mention, in hospitals, physical therapy clinics, um, nursing homes, skilled nursing facilities, which are not necessarily nursing homes, school districts. But besides the work settings, there are also pathways of jobs that both categories of therapists might want to consider. For example, there is the pathway of clinical management. So clinical management means that you are typically working in a healthcare providing setting, such as a hospital or physical therapy clinic, but you're responsible for the clinical aspects of healthcare delivery, and you're supervising a staff who are the clinicians. Then there is the rehab manager. So a rehab manager tends to work more in nursing homes or SNF units, sometimes home health agencies, and this again is a management level position, may do clinical work, but also oversees staff in terms of making sure that there's sufficient productivity for reimbursement, that the services that are being provided provide the depth and breadth of what physical therapy can do. Both PTs and PTAs can own physical therapy clinics. Um, Another job area would be a consultant. A consultant can work for places like insurance companies, reviewing documentation to make sure that that documentation meets the criteria of the insurance carrier for reimbursement. Or they can work in military institutions as public employees. I have a couple of grads who have worked at Fort Bliss as an example. Then there are lots of special needs organizations out there for autism, for cerebral palsy, for stroke, and those agencies also provide consultative types of therapists, PTs and PTAs. And then there's education. So I'm the program director for this program, and so a PTA can be the program director as long as they have a master's degree. Uh, let's see. And so I wanted to give you a couple of statistics about physical therapy in general. There are 7,550 physical therapist assistants in Texas. Now, you might be wondering why I am emphasizing the word assistant in physical therapist assistant. And that is because a physical therapist assistant is a person who has received an associate's degree from an accredited physical therapist assistant program. A physical therapy assistant or a physical therapy aide is just that. They're both aides. So it is important to make that distinction because a lot of times when you go into physical therapy clinics, you need to look at the name tag that they have on them to make sure that they are who you think they might be. Just because they wear a white coat does not mean that they're a doctor. Just because it says physical therapy across their name tag does not mean that they are a physical therapist or a physical therapist assistant. And so that's why I'm making the distinction. So 7,500 physical therapist assistants in Texas. Texas is actually the largest employer of physical therapist assistants, but we only have 32 PTAs per 100,000 people in Texas. So actually, even though we might be the biggest employer, we have a much greater population that needs physical therapist assistance to be working in Texas. In fact, there are 17 states in the country that have more physical salary is pretty good. The median salary, the most frequent one, is $52,000 a year. And of course, that varies depending upon a lot of things. The physical therapy as a profession is predominantly female. And as a result of that, women tend to take time off from work to raise kids and family and or work part-time. And so that does affect the median income. And to look at that, $27 different kinds of the profession is predominantly female. It's also predominantly Anglo. Our profession, along with many other health professions, have been working really hard to increase the number and the diversity, the cultural diversity of its association members. And so there is a pretty large Hispanic population of therapists, 8%. You might not think that's very big, but it actually is big, but it does need to be much bigger as our population distribution keeps changing. When you take a look at the Texas workforce requirements for is this increasing need for them as a result of the aging of America. The baby boomers are coming into their retirement age. Excuse me. And then but it's not only the baby boomers. Physical therapy as a profession works with all age groups, from babies all the way up to persons who are getting ready to pass on. And we work in a variety of settings, like I mentioned. So the opportunities for creative jobs is incredible. You can work with kids in the school setting. You can work with kids in a pediatric clinic. You can work with athletes. You can work with athletes in a regular ISD type of setting. You can work with athletes as part of a private practice physical therapy clinic who sees kids who have had soccer and or football injuries. There are so many different kinds of injuries that affect the body physically that filter down to the physical therapist assistant team. We are the only profession in which there is a huge physical component to working with people. So having the qualities of good communication skills, liking to be touched, open to touching other people, those are really important physical characteristics of people within my profession, because we have to help people get out of bed. We have to help people to learn how to walk again, to learn how to run, to learn how to jump again. We have to help them compassionately through all the various levels of pain that they have and encourage them to work through that pain so that they can go back to doing what it is that they did before they were injured. But injury isn't the only area that we work with. We see lots of patients with neurological problems. These problems express themselves as balance problems or difficulty walking, but it's not due to a physical injury like a broken leg or a knee replacement or a hip replacement. It's due to something that's not working right in the central nervous system, either the brain or the spinal cord. As I talk to you, you can see that our profession is heavily based in science, particularly in anatomy and physiology. We work with the entire system of the body. Granted, the musculoskeletal and the neuromusculoskeletal systems and the three most important systems. But we also work with the cardiovascular system, with the respiratory system, because patients get out of breath when they walk. Patients' blood pressure goes up because we're asking them to walk when they're in pain. Patients that have been in bed for a long time, they get dizzy when they come to sit on the edge of the bed. And so all of the systems of the body are really important for physical therapy. Our Physical Therapy Association has lots of public information as well. And if you are interested in learning more about physical therapy and what it has to offer you as the public, choosept.com is the place to go. There you can find a therapist. There you can learn more about different disabilities or disorders that you might have and what kind of therapy you might need. You can find a therapist that can help you with those problems. And so at this point, I think I've pretty much covered the topics I thought might be important, but I would be open to hearing your questions.
Would you like me to show the program page?
Yes, because there may be some questions about that. So for those of you that might be thinking about coming into the program or know somebody that might be interested, there is a specialized admissions procedure, and there are 5 courses that are required to take prior to engaging in the specialized admissions process. Anatomy and Physiology 1 and 2 are 2 of those. Medical Terminology is another one. Introduction to Physical Therapy is a 4th one, and then we have an ethics and some other cores like English and normal development or lifespan growth and development. Some of those prerequisite courses require a B or better to get into the program, and all of the Gen Ed is at a minimum a C to get into the program. Our requirements for GPA are 3.0, and we do have TSI 2 scores that are a little bit higher than the college's entrance requirements. So somebody in the chat had mentioned UTSB. No, it's UTMB in Galveston. That's the college that we have a bridge with. The program information guide that is up on our website has lots of information about how to get into the program. It mentions our counselors, Martha Brown and Priscilla Tomei, as being our main counselors for the program. Are there any questions that the audience might have?
Could you talk about what you do after you graduate for the certification?
Yes, after graduation, there is a licensing exam that every student has to take. Our capstone course, which is one of the final courses in the last semester, preps them for that. And there are multiple mocks that they have to meet specific benchmarks for to even pass that course before they can even graduate. So once they do graduate, the licensing exam is a requirement in order to practice in every state in the country. Like most health occupations and other medical professions, these exams are costly, and so we do our best to help our students pass that on the first exam. Our exams cost about $600 each time. hopefully our students have to only take it once. We have a 90% first-time pass rate on our licensing exams, and we're approaching almost 100% for ultimate pass rates on our licensing exams. Once the student graduate becomes a licensed therapist, they can work wherever they want to. You get licensed in one state, but you can apply for licensure in other states. And recently, there has been a compact being created across the country where if you want to work in another state that's part of the contract, for example, Colorado, then you only have to pay a small fee to then be licensed in that state as well. And that really has come as a result of COVID and all of the telemedicine that has been approved, making multiple state licensure a real possibility. Traveling physical therapy is one thing that I hadn't mentioned, and a lot of therapists do this. You work for a company and they send you all over the country to work for the 10 weeks or 12 weeks. And at each one of these facilities, you get to learn all sorts of new stuff that maybe you didn't actually get to learn in school because school can only teach so much.
And here in El Paso, how is the job market for this? You said Texas has quite a few, so it's pretty
Yeah, I mean, I've had 100% pass rate for 100% employment rate forever. I mean, ever since I started the program. So there's never a problem finding jobs, even with COVID. There was not a problem with my students finding jobs, finding the job that they wanted. I mean, their first pick, their first place where they would work, they might not have gotten, but they all are fully employed, working somewhere. A lot of my students choose to work in home health because that is a higher paying work setting. And now with COVID, my anticipation is that that area, which was hit hard by COVID because um, clearly the agencies, the home health care agencies didn't have the personal protective equipment that they needed for their therapists. But now that that has kind of resolved itself, that work environment is going to be increasing as COVID survivors have multiple comorbidities that appear as a result of COVID. You know, I don't know if that you've been reading or listening to the news, but some of the side effects of COVID include continued respiratory endurance problems, which means labored breathing whenever you want to do anything. There's a lot of fatigue that happens with COVID survivors. There is weaknesses. And so physical therapy is one of the big professions that provides services to the COVID survivors to be able to get back to their life, both physically and with enough cardiopulmonary endurance to be able to enjoy life again.
Thank you. Thank you. And Mr. Castro has a question also.
I used to work as a aquatherapist for a physician by the name of Dr. Biganowski. So I saw how difficult but also rewarding it was for the physical therapist assistants, including the physical therapist. They would do hot and cold treatments. We had acupuncture. We had holistic medicine. It was great. So to be with these patients in the water to help them, you know, after a traumatic motor vehicle accident or, you know, some sort of spine adhesion that they would have. And it was really unique stuff. So definitely a field that I feel is much respected. Absolutely. And to add on to the COVID, you know, these locations as well, if they're not added to the CARES Act, you know, you're getting your pay, but right now the government has so much money for that CARES Act. So if you have COVID and you're doing these or charging for these procedures, with the CARES Act, you're getting paid at 100%. So something to consider for those who have their own practice and you're not with the CARES Act, please get registered as quickly as possible and start getting that funding back. There's a lot of money out there for you.
Right. I didn't emphasize so much of all of the different machines that physical therapy uses, because you're right. There are many, many machines that we can use, but traditionally physical therapy is a very manual skill. It's our hands. It's our ability to mold your body like a piece of clay so that you can go back to walking normally, to being able to stand. Right. Aquatherapy is a medium in which physical therapy does, which the physical therapist or the physical therapist assistant performs the physical therapy interventions. Yes.
Thank you. And so if someone is interested in this program, what do you recommend that they do? What should they do to get more information?
Well, anybody that sends an inquiry to me, I usually forward directly to either Martha Brown or Priscilla Tomei, because those counselors can really help students who are interested in starting to take the right courses in the right sequence so that they don't waste time, waste money, and can graduate on time. But for people that are interested in the diversity of the profession and what are the possibilities, I would highly recommend that they go to the choosept.com website, where there's tons of videos that talk to you about all of the different um, avenues that physical therapy offers. This particular profession is a lifelong career, and if you get bored in one work setting, you can move to a different work setting and just keep moving to a variety of different work settings and not necessarily doing the same thing that you did at the last work environment that you worked at. There is so much creativity um, that is there. So thanks for putting that website back up. That's where I had started with that picture. And another place to go to learn more about our profession is the American Physical Therapy Association. You just type in apta.org, and that takes you directly there, where you'll find more information. So the advocacy area is one place where the public typically tends to go, and your career is another place where the public tends to go if they want to find out more about the actual career of physical therapy, for the physical therapist assistant or the physical therapist. And of course, I mean, you can always contact me. I get emails all the time. My email address is um, on the program guide that is on the program's website. Or you can just type in physical therapy on the college's website and it will get to my website.
I'm sharing that screen right now so we can get your contact information. There you are.
I wish that was me. I no longer look that young.
And there's your contact information down at the bottom.
Yes.
And then also Miss Brown is the counselor, and we shared her information earlier as well, so you can contact her as well to get some information about how to get into this program. Are there any questions? Thank you so much, Dr. Brown. This was a great presentation to learn more about that program, so we really appreciate that. We look forward to hearing more in the future as well. So thank you so much for being here, and to Mr. Castro also for being here and sharing about his programs. And thank you to everyone for coming today. We really appreciate you taking the time to come in and learn more about our great programs here at EPCC. I have put a survey and a link to get your Tejano passport points. There won't be any workshops next week because we are closed for holidays on Wednesday and Friday when we usually have our Tejano virtual events, but we'll be back the following week On Friday, we'll be talking about criminal justice and psychology programs at EPCC. So we hope you can join us then. So I hope you all have a great day and a great weekend. So thank you all.
Thank you. Bye-bye.